You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, I will discuss a patient that I saw about 1 week ago who came in with a finger problem. Her name was Elizabeth. She was a 28-year-old African-American female, very healthy. She came into the emergency department because her right index finger was swollen. It had been painful for the last 3 days, and each day she had more redness and more discomfort. It was so bad that she couldn't sleep. And so her employer actually sent her in because she tried to go to work that day and she wasn't able to hold a mouse or type properly. Now, when I saw Elizabeth in the ER, she was in tears. That finger was really, really painful. She denied any injury, though. She had not fallen. She didn't remember crushing it. She didn't remember doing anything. She wasn't stung by an insect. There was simply no cause as to why her finger was so swollen and painful. And then I asked her a few more questions, and I was able to come up with the correct diagnosis. When I looked at her fingers, she had manicured all of her nails. She had a very nice layer of nail polish, and it was clear that she had been to a salon in the recent few days. And she said yes, she had no pain prior to going to the nail salon, but the day after she went to the nail salon, her right index finger became swollen. And that's when I realized she actually had an infection called a paronychia. And that's what we're going to talk about today. So a paronychia is either a fingernail, thumbnail, or toenail infection. It can be caused by several simple things that you may not even realize. One of the most common is actually from nail salons. Now, what happens with the fingernail or toenail is that there are different parts to the nail itself. Most of the nail is actually dead. It's made up of keratin. There's no sensation. There's no feeling. It doesn't hurt when you trim or clip your nails. However, the cuticle, which is the very sensitive area underneath the skin, is actually where the living part of the nail is created, and that's called a matrix. Now, this woman, Elizabeth, had gone to the nail salon. She had done all the right things. She had been taking care of herself. She didn't bite her nails. She didn't remember any hangnails that she had pulled, but I believe that the nail salon stylist had actually been a little bit aggressive. They may have used some tools to force the cuticle a little bit. They may have applied some manipulation or pressure, and that actually allowed infection to go underneath the nail, and that led to the paronychia. Now, with the paronychia, the problem is that the infection, which is usually caused by staph or other similar bacteria, it has nowhere to go. So, for example, if you had a pimple, you would think of it as coming up above the skin, and then after a few days, the pimple may pop, and then the pus will drain out. With this situation, a paronychia, the infection actually goes deeper, under the skin and towards the knuckle of either the fingernail, thumbnail, or the toenail. And that's where the pain becomes very, very intense. In her situation, because she had waited 3 days before seeing me, the pressure had been increasing. And the number of nerves, especially in the index finger, is very, very high. There are thousands of nerves per square inch, and all of them were inflamed. They were all angry at her, and that was because of the infection. Now, in her situation, she had not really tried any medication. She didn't do anything over the counter to make it feel better beyond trying some Tylenol or Advil, and so the infection had a head start. It was actually progressing. And at some point, a paronychia can actually convert into a more severe infection called a felon. That's spelled F-E-L-O-N, felon. That's basically where the entire finger begins to become swollen and hot, almost like a tomato. And that's because each knuckle is a separate compartment. It's a separate room, if you will, of the finger, and it begins to swell more and more. So those people, they don't even let you touch the finger or the toe. They can't even put their socks on. They can't put their clothing on. They can't even wash their hands. It's that sensitive and painful. Now, in her situation, because she had gone to a nail salon, I believe that they did the proper sanitization. They used the proper tools, but her skin was a little bit sensitive. It had already become infected before she left the salon, and that worsened over several days. There are a couple of home remedies that may be effective if the infection is mild. One of the most common ways is to apply warm soaks. So the easiest way is to take a cup, you fill it up with some nice hot water, and you add Epsom salt. You can then dip your fingernail or your toenail in that hot water solution with the Epsom salt. The idea is that the heat will force the paronychia into a head, almost like a volcano, and that way it may drain out on its own. The other theory is that the Epsom salt, because it's salt, actually kills some of the infection and it softens the skin, again, to allow the body a chance to fight off the infection. Some people will try Neosporin or bacitracin or any of the over-the-counter antibiotic salves, and sometimes they get lucky and it will go away. There's a few things you should not do, however. You should not squeeze a paronychia, because the more you squeeze the finger or the toe to try to push the pus out, the worse it gets, because the pus or the infection actually spreads deeper into the area that's soft around the finger tip itself or the toenail, and the infection can actually spread more rapidly. So you should not squeeze this area at home. You should also not try to drain it at home. You don't have, in general, sterile tools. You don't have a scalpel. You don't have any lidocaine or any anesthetic. So it's not recommended that you try to heat up a pin and poke it into your own finger or toe to drain the pus, because that's actually going to make your situation much, much worse. Now, in the case of Elizabeth, what I advised her was that she needed an injection of antibiotics along with oral antibiotics by prescription and some topical antibiotics by prescription. So this is what we call triple coverage. So we gave her the shot in the emergency department so that it would begin to work within a few hours. I gave her the oral antibiotics to take for about 10 days, and I gave her the topical antibiotics to basically cover that area. And we called her a few days later, and her finger was completely cured. So she had no long-term side effects. She did not lose the fingernail. She did not even have to get the shellac and the nail polish removed from her fingernail, and she was very, very pleased. So I'm glad that she came in when she did. Otherwise, it could have turned into a very, very serious problem. So again, we talked today about paronychia, which can lead to a Felon, which is a very serious and very painful infection. The most common causes: going to a nail salon, pulling a hangnail, any kind of simple injuries, insect bites, even small cuticles that can get infected. The key is do not squeeze paronychias or Felons. Do not try to cut them at home. Always go see your doctor, talk to someone to get on proper medications and antibiotics. Do the warm water soaks, and I think you'll heal from that very, very quickly. If you or someone that you know has had a Felon or a paronychia and you want to send us photos of that, I'm happy to put that on our social media. You can connect with us on Twitter and Facebook. If you have any future questions or other thoughts about an episode that we haven't covered, I also welcome your feedback as well. Thank you so much for joining me on today's episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.